white coat ceremony. White coat ceremony. So I actually was very much against white coat ceremonies, and I'll tell you. Yeah, no, that is the truth, and I'll explain a bit about why I was wrong, and where I think. We have helped here at Penn move our white coat ceremony to a slightly different place, and I think that that's the important part of where we go with it. So I want to welcome friends and family. Tamara, I'd like to formally introduce, but Vice Provost will welcome, and our alumni, our faculty that are with us today, as well as our class of 2025 past students. I welcome all of you to come today to today's great event. It's great that we're gathering here in person to present these white coats. It's something that, quite frankly, the two past classes before you did not have this occur, and it was because of a pandemic that occurred. Some of you who are watching virtually, we welcome you here and look forward to actually seeing you here at Penn Dental Medicine so that you can get a feeling for the great institution that this is. We're entering our fourth year of what people told us was an unprecedented pandemic. And that's really quite incredible when we think about going into our fourth year of this pandemic. Now we're seeing children and adults, aging population affected by flu, RSV virus, and COVID-19 still. This year, due to the pandemic, we're operating differently at our school, and the rules keep changing. What we decided last month as being the necessary rule isn't necessarily next month. You know, it's kind of interesting, and it's part of your being in the healthcare profession that we actually discuss this, and I need to focus on the implications of this pandemic on you as dentists and healthcare. We've become numb to the fact that we have 450 deaths from COVID every day right now. We see about 100 flu deaths right now in the United States. This is just in the United States. We can't even talk globally. Globally, these numbers, are not highly accurate, but they literally blow our minds. This is the first time in the last few years that American life expectancy has actually decreased because of this disease. And since the start of the pandemic, which we declared started at the February, March of 2020, 3 full years ago, 1 million Americans have died. That's terrible. It's changed healthcare, and the dentist's role in healthcare has really had an opportunity to mature during this particular pandemic. 2 years ago, exactly 2 years ago, when we came back to Penn Dental Medicine, and our students and faculty were on the front lines treating patients, and we were amongst the first nationally to be able to receive a new mRNA vaccine. And the competition to get these very limited doses into our arms was really quite remarkable. And as a school, Penn supported us, and we got our entire dental school vaccinated within the first several months of vaccine availability, which you probably don't even remember that these vaccines were in short supply, that they were deciding whether this physician had enough contact with an individual that they should be getting this vaccine versus a different healthcare provider. Dentistry was recognized as an essential and high-risk program, and our school was actually given the opportunity to get people vaccinated, and our entire school has in fact done so, and then been boosted, and then boosted again, and then boosted again. But story for yet another moment. Important for you who are entering here, where was the mRNA vaccine invented? University of Pennsylvania. The mRNA COVID vaccine was invented by others, but the actual carrier, that mRNA vaccine, was invented here. That's pretty telling of our university and where things are going and how you will learn over the next 2.5 years on your venture to become a practitioner here in the United States. You each come here with a very special lens. This vaccine, we know that if you've had the vaccine and been brought up to date on your boosters, and if you get COVID, the likelihood of you actually being hospitalized is less than 1%. The likelihood of you dying is measured in the tenths of a percent. That's incredible. We rapidly looked at the evidence and moved towards this concept of vaccination. And we trained our students as to why, and we looked at how and where. You have come to us with a special lens to view these events, both the global lens and the dentist scientific lens. It's taken a tremendous commitment for you to be here, and we do recognize that and welcome you into this family. I need you to understand what it means to become a healthcare provider, and where things have gone and what we need to do to be part of the public health. We need to become advocates for public health, no matter where we practice, and no matter what the public health measure is. We have to become informed consumers and informed advocates for our patients and patients' health. So what's actually the biggest problems that are occurring today? You know, in 2020, less than 5 million people had been infected with the COVID virus in the United States. 169,000 at the end of 2020 had died. Today we're looking at 1 million who have died, 100 million who have been infected. Worldwide, 650 million people infected with over 7 million deaths. But that actually isn't the worst thing that's come out of COVID. It's horrendous, don't get me wrong. The worst thing is that a series of disinformations have managed to take into discussions that people start questioning science and the process of science. You know, first you had to disinfect every surface, you couldn't shake hands, you couldn't get near, you couldn't do this. We learned as time went on, and it evolved, and we had different discussions on what we had to do to protect ourselves. Some people look at that the opposite way and say science had no idea about this disease, and they made up stories and they were inaccurate. Don't wear the mask, do wear the mask, don't wear the mask, and their masking caused, masking didn't. But the ability today to have a narrative that is inaccurate is just overwhelming in where we go. And who do people turn to get advice about the best ways of doing things? Well, you can go to any of, and I'm not going to pick on any of the online medias. You can Google things, and if you Google fluoride, the first 400 items that you read are that fluoride is a poison and is damaging to the person's health. Not about the fact that it's reduced tooth decay by 80%. If you Google vaccines today, if you go ahead, and I don't want to pick on Google, it's not a question of Google, it's just how we get our information. We have people today that are refusing to get boosters because of things they heard on the internet or they heard from friends. And everybody's entitled to have personal opinions, but when it comes out to harm individuals and harm society, this disinformation has a totally different story. So if I told you that people today have been diagnosed with polio in the United States because a group of people don't believe the polio vaccine is effective, measles, mumps, and rubella are re-emerging in American society today, because discussions about vaccines are now taking a real negative turn. How do we deal with this as a modern society? We deal with this by being informed healthcare providers. That when the patient sits down and trusts you to do something, they also trust you to come with accurate information. And sometimes we have to have uncomfortable conversations that say, you should take this HPV vaccination because it eliminates 80% of oral and cervical cancers. I don't want to talk to you about sexual relations and where things are going and how. I'm a dentist, I'm not comfortable. But not having that conversation puts a tremendous number of people in this world at risk. Not having conversations and asking an aging adult, have you gotten your flu vaccine, puts that individual at risk. Your ability to read the science when you graduate Penn puts you amongst a very rarefied group of professionals that have the opportunity to become the confidant, the important indicator of where we can go with health. That's what coming to Penn Dental Medicine and becoming a class of 2025 graduate will do. You become part of a healthcare system that cares more about health of the individual than just the tooth. We become trusted public health communicators of science. It's part of the meaning of the oath that we will ask you to take with the white coat. So I didn't believe, it's actually really okay, everybody just sit and children cry. No, don't go anywhere, you just should listen. That's a father or a mother that's going, no, too disturbing. Which is very courteous and very appropriate. Penn Dental Medicine has a long history of this, and I actually got the chance to remind myself of it. You're new residents to Philadelphia. You should go to the Physicians College of Physicians on 22nd Street, the Mutter Museum, and take a tour there. It actually talks about this pandemic and the influence of the pandemic and and the 600,000 Americans that, oh, it was not this pandemic, it was the 1915 pandemic. It was a flu pandemic that they thought would be cured by drinking a whiskey mixture and eating cucumber sandwiches. It hit the United States. They needed to have a bond parade. The health officials said, please don't bring all these people together in one place. This is not going to be a good thing. There was no such thing as masks, that they were virtually not available. It was thought that spit actually caused, spitting on the streets is what caused the flu pandemic. But they brought all of these people together, and within weeks, Philadelphia was fully embroiled in 2 years of death that just swarmed over an entire city. It's interesting because Penn Dental Medicine, our first major donor, Thomas Evans, who did charge the school to be second to none, the building that you can get to walk through in a few minutes, it's a gorgeous building, was constructed off of his gift and opened in 1915, just before that pandemic. The first class admitted into that building actually took a week off to go help with the flu pandemic and isolating people that had the flu. It's a remarkable item that the school participated in the public health venture 105, I'm not good at 107 years ago, about 100 years ago. And that's remarkable to see. We're going to have conversation with you in a few minutes about taking an oath that makes you part of this public health mechanism, that makes you part of this mechanism of taking care of others in a selfless fashion. Today, our big needs are for us to be able to have people that deal with life-threatening diseases and talk fact to fiction, that do things that make you consumers of science, the very best of it. And we hope that we will do this no matter what our political positions may be. We have to be honest consumers of science and recognize that the fact that we read it on the internet or we looked at it here or there is not equal science throughout. And that is what we are charging you with. So I didn't think that white coat ceremonies were appropriate because I didn't think that individuals in their earliest moments in a school could actually understand that white coat significance. I told you I was wrong because part of it is the fact that you can understand and you can accept the responsibilities, and I hope that you do, because the alternative is to not be here the remaining 2.5 years. I am serious. And I think that you will have certain things out of the white coat. It's actually remarkable. White coat ceremonies weren't always. White coat ceremonies came out of Columbia University School of Medicine in, I think it was I have it on my notes here somewhere, 1990 if I recall. And they were put in place to essentially have people read the Hippocratic Oath. Some people look at these white coats and suddenly look and go, that's a much smarter person. But it's a much more trusted person is the actual what it is. The white coat, it wasn't always a white coat. Back in the late 1800s, physicians actually wore black coats. They also wore long-beaked masks to protect them from evil. It was supposed to scare them away. We look at this white coat today as becoming part of a fraternity or a sorority. And if that's what we actually think this is, we're really very faulted and wrong. The white coat ceremony is a special event. I did forget to introduce myself, that's right. Actually, no, I did put it on like page 4 or 5 of my discussion. I am the Dean at Penn Dental Medicine. I'm the 12th Dean, and I'm honored to be here to speak with you about this today. Doing this in the first days binds you to a certain right of being a doctor. And for any family member that ever uses the term, well, you know, he or she is a dentist, and they're a doctor, referring to a son, daughter who might be a physician as by skill. Those of us with PhDs don't believe any of these people are doctors. But that's a different story. We can't get hotel reservations with the PhD or dinner reservations, but you know, the doctor who wears the white coat, maybe. No, actually, that doesn't help there. You know, you're going to be a professional 365 days of the year. It's never a day off. You are a doctor. We are expected to do things for our patients because it's in the patient's best interest. It's in the society's best interest, because even if it's, you know, and it's what the white coat binds us. It's that level of trust that a patient will look at you and ask a question that might not even be in your specialty. It's because they recognize that you probably are more educated than they are, or you have access to information that they may not have. Our obligation is to share that. Going from these black coats, do you know why we went to white? You can actually see the blood stains if it was on the coat at the time. It had to do with infection control. You went from black. They thought that by wearing black, nobody could see it. And when Lister came about and talked about infection control, white became the appropriate color. It was associated with cleanliness and the very beginning of what I would call science. You know, as many people died on the battlefield of bullets as died on the battlefield of post-surgical infections during the Civil War. The healthcare provider didn't know everything about how to take care of their patient. Science actually exploded in the late 1800s, and we have that wonderful benefit of living in that today. People are going to know that you're important because of who you are in what you're doing for them. Not important because of the degrees you're going to get out of Penn. That's important, and we do expect you to complete paying for it. But the key is that people will hear from you in the way you communicate to them about health and about them. Wearing the white coat says more to a patient than you follow infection controls that were made by Lister. As a matter of fact, most patients don't even associate the coat with infection control. They associate the coat with something much more. Wearing the white coat does say to the public that you're smart and well educated. We know that you're smart. You made it here to UPenn. And we know that you'll be well educated or we won't let you out of Penn. No freebies. Wearing the white coat says to the public that you'll spend a lifetime learning, because as I said, what we knew about the pandemic 2 years ago or 3 years ago is different than what we know about the pandemic today. That you'll understand the reason why, not just temporarily learning the answer. That you'll be willing to change, you'll be willing to question the evidence and ask why things are occurring. Wearing the white coat is an obligation that you'll have even when you're not wearing the white coat. You will be the person that's responsible for saving a life one day. It could be anywhere. But part of putting on the white coat is deciding that you will do that as part of a society. And that's so important in where we are. It says to the public that you're about your community. We expect you to do more than hide in your community. We hope that you'll help lead your communities. We hope that you'll help educate, and that could be on the soccer field, it could be in a parent-teacher organization, it could be in a medical society, in a dental society, in politics or around. You and your intelligence needs to help lead. Wearing the white coat says to the public that you're compassionate in your treatment for patients. You respect their dignity, their privacy, no matter who the patient may be. You owe that to the individual. Truly, wearing the white coat is an important item. This oath that we're going to ask you to take in a few moments helps define who should be a professional and wear the white coat. Participating in the ceremony and putting you on your white coat means that you agree to fulfill the mandates of our profession. Putting on the white coat is much heavier than just the fabric. It's everything we expect of you. I need to congratulate you, your families, and all involved in getting you to this point. I welcome you to the Penn Dental Medicine family. It will be with you for the rest of your life. You're part of a historic school doing historic things, and I promise you that it'll be an exciting ride to get here. So with that, I will ask, with that I'll flip through my libretto here. When I saw the libretto, I realized immediately that my geriatric eyes might not be able to read it without getting a copy that was done in, giant poster board. So today's speaker is, today's guest speaker is Ms. Tamara Greenfield King. Ms. King serves as our interim vice provost for university life and senior associate vice provost for student affairs. She came to Penn in 2019, and after 20 years in a position of increasing responsibility at Washington University St. Louis, culminating in Associate Vice Chancellor for Student Support and Wellness. She's a sought-after expert in student conduct and Title IX, serving as the first African-American president of the Association for Student Conduct Administration and Conduct Administration. Prior to higher education, Ms. King was the first African-American assistant district attorney in Northampton County, Pennsylvania. She earned her law degree from New York University and a baccalaureate degree in political science from Penn State University. A great game yesterday. Rose Bowl, those of you who weren't paying attention. We are delighted to have Tamara and have her be able to issue some welcome to you here at Penn Dental Medicine from herself and from the university. Tamara, please. Thank you. Oh, you need this microphone too. Thank you.
Good evening, good evening, good evening. It is indeed a pleasure for me to attend and have the opportunity to say a few words to you all about this ceremony and this very special and serious occasion. I just wanted to say to Dean Wolf, thank you. I learned a lot just listening to you in the last few minutes that I didn't know. I'm a history buff, so I enjoyed some of the medical history, thank you. And to the administrators, the faculty, and the staff that work tirelessly in Penn Dental Medicine, thank you for inviting me. I'm not going to be in front of you for a long time, but I want to say a few things about your journey. First, welcome to the University of Pennsylvania. You have joined the ranks of scholars, of researchers, and innovators. And that is what we expect in the next 2.5 years, that what you learn, you will take forward and be innovative and creative, and in some ways change the role of dentistry at some point. We are delighted that you're here with many of your family, friends, and I hear some little children. So I know that they have supported you, they have propped you up, they have given you the space, the time, and the ability to be successful. You would not be here if you were not successful. Again, my name is Tamara Greenfield King. I'm currently serving as the interim Vice Provost in University Life, which means I get to talk about and work with students on lots of events and activities outside of the classroom. So to make your time at Penn not just about the academic rigor, but about your social life, your well-being, and getting to explore Philadelphia. I've been working in higher education for over 35 years. And I'm going to digress just for a moment, because when you're a lawyer, most of us don't tell our doctors that we're lawyers, because they then pull out, one of my doctors pulled out my old, before electronic records, pulled out my folder and wrote across the top, attorney. And I thought, wow, that makes me special. So I don't know if that was good or bad, but we don't like to tell the doctor that we're a lawyer just in case. So I want to just put that out there. I try not to tell people that. I just say, oh, I work at Penn, and leave it alone. So again, I work in student affairs, and that is the division that really works with undergrad students and then graduate and professional students, which you all are at this moment. And we try to help you with your journey over the next 2.5 years here at Penn. So I'm going to give you some unsolicited advice, but I think that you should think about it as you go through this journey. Number one, you all are all here for one purpose, and that is to complete the program to earn the degree. And Dr. Dean Wolf has already said, and they're not going to hand it to you, you're going to have to earn it. So with that, study, 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 and study some more. So it's a great program. You all, believe it or not, are the best and the brightest, not just in the country, but in the world. So that is a huge responsibility as you embark on this journey. The other thing I'm going to tell you is make friends, branch out, Talk to people from other countries. Learn about culture, religion, food, diet, and how all of that impacts your dental health. Along the way, I am certain you will make some lifelong friends. Third, you are in one of the most vibrant cities in the country. Get out and explore. So they talked about the Mutter Museum, which is absolutely fabulous. You would love it. Make sure you go, put it on your bucket list. There's all sorts of ethnic and cultural foods in the city of Philadelphia. Sporting events. If we're fortunate, we might get to see a Super Bowl win. If we're fortunate, we got to get our quarterback back in shape. Lots of cultural events. On January 1st, we had the historic Mummers Day Parade. Lots of shopping, all different types of shopping, not just high-end, some just basic things, but get out and explore. The other thing is, although we're in a metropolitan area, there's hiking trails, there's bike paths. You're going to have to clear your head every once in a while. You're going to have to decompress. You're going to have to take in some deep breaths, right? So make sure that you are prepared to engage in some of that recreation while you go through your journey. So many of you don't realize the northeast of the US is compressed. So you can go from Boston to DC in a matter of hours. So you got Boston, Connecticut, New York, New Jersey, Philadelphia, Baltimore, and Washington, D.C., all in a corridor. Don't just stay in Philadelphia. Get out and explore, because you might not have an opportunity again, but please explore all of those cities. When you have a break, once all your exams are completed and you are matriculating through the process. Finally, or not finally, get involved on the campus. There's some grad and professional student organizations. You cannot major in student activities. It won't work for you here, okay? You gotta be on the studying trail and doing that seriously. But there might be some opportunity for you to meet some other grad and professional students here at the university. So we talked, Dean Wolf talked about the trust that a doctor has. So I'm not a physician. I was like, I cannot memorize all of those body parts, how it all works. I just can't do it. So I leave that to those of you who are smart and able to do that. But you are entrusted, not just with people's confidence, but with their lives. When I go to my doctor, I expect them to know the answer or to tell me they don't know the answer and that they'll research it and get back to me. So that's a serious indicator. And I'll digress again for a moment. So I'm a sports person. So if you watched the Buffalo Bills and the Bengals yesterday, you saw a player go into cardiac arrest on the field. So when Dean Wolf talks about saving a life anywhere, have you ever been on a plane? Someone has an issue. We're going to look to you all with your medical knowledge to assist and help. The other thing that I think about often when I was at my former institution, it was graduation day. It was a big ceremony, and it's hot, and we had a lot of elderly grandparents who were visiting, and one of the grandparents collapsed, and it was our medical students who saved their life that day. So again, that's a serious endeavor that you're undertaking. So I'm going to talk very quickly about an issue because I think it's important. So let's assume things aren't going as you think or suggest that they should be. I need you to put your pride aside and reach out to the administrators and the faculty in this dental school. Why do I say that? They're here to help you. They're here to see you succeed and to be successful. So don't wait until the problem is so massive that you cannot see your way out. Early on, if you have an issue, please go to the faculty, staff, administrators to have that conversation so that they can address it in an appropriate fashion. And it is not a sign of weakness to ask for help. Everyone in the room is invested in your success. You are loved by your family, your friends, your colleagues, and your peers, and your patients. So as I stated in the beginning, what part will you play in moving dental medicine forward? So I don't know a lot about medicine, but what I will say is they always tell me that everything starts with the mouth. If you have poor dental hygiene, that's going to lead to poor health in other areas. Lots of people don't understand that concept. So what part are you going to do to make not just Penn, Philadelphia, the US a better place, but the world globally a better place? Are you going to hold on to your knowledge? You're going to share it? You're going to be innovative? It's a loss if all you do is hold on to your knowledge and not spread what you know for others to learn by. I'm going to say enjoy the US. There is a lot to see if you are not from the US. You will need breaks along your journey. If you ever are down on the main campus, which you may or may not be, you're really going to be living up here. But if you are down there, stop by my office. I'm right on Locust Walk. If I'm available, I'd love to have a cup of coffee or a cup of tea with you. Not a problem. And the best of luck in the next 2.5 years. It is a journey. You have been chosen to embark upon that journey. And I have absolutely no reservation that you all will be successful. Thank you so much.
So I'm going to leave this here for one moment before you mask up. We need to make you an honorary dentist. You'll get full billing capability. We'll go through all of that, and so if you would mind, yeah, here we go.
All right.
There we go. Excellent.
Why, thank you.
There you go.
Now, I have a cousin who is a doctor in Florida, so I'm going to take a picture and
There
send
you go.
it to her.
And, that's it. You've just been knighted.
Thank you so much.
With this, I would like to introduce our Associate Dean, Dr. Yuri Hangorsky, to take over the rest of the emceeing. He follows the plot much better than I do, which is good. Thank you.
Thank you. So good evening to all. It's my pleasure to be part of this momentous ceremony, which is the first one for our incoming past students. Just wanted to congratulate you. I know it was a very long, arduous journey to get here, but I also know that many of you had the opportunity to attend other institutions, so I want to promise you on behalf of all my colleagues, we will work very hard to validate your choice and make sure that you made the best choice of your professional life to come here. But now we're coming to the important part, which we are here gathered for, and we need to introduce you. So what I would ask that in alphabetical order, each one of you come here and please state your name and your country of origin. You will be cloaked by a faculty member of stage. We have two great colleagues of mine who were also my former students, Dr. Joyce Abt and Dr. Eric Spiller. They are both associate clinical professors, and they will be helping cloaking you. So please proceed to the center stage. You will be congratulated by Dean Wolf. A picture will be taken, and you will be able to download this picture later on. So thank you once again, and please hold your applause until all the white coats have been distributed. Okay. So we start with the first student.
Lulia Alawa, Damascus, Syria.
If you'd like to take your mask off for the photo, you can. Then put it back on quickly.
Kashmala Mirzada, Pakistan. Elahe Askari, Iran. Fadia Baksh, Pakistan.
And you need to talk your hair, because I know you won't be happy with the picture. It's tough. And now you can
Sarah Benilam, Iraq.
Yes, yes.
Catherine Bencosme, Dominican Republic.
You may take off the mask if you don't have to.
Hitvi Brahmbhatt from India.
We need the shield and your picture. Congratulations.
Amarjot Brar, and I'm from India.
Yeah, well, I know my own daughters would kill me. Another hair.
Sangeeta Buddha from Nepal.
And I know that's just not acceptable. You got the hair. Well, you may take off your mask if you.
Pamela García, Perú.
Sona Elizabeth Chaco, India.
Maunika Shamarti, India.
Rafaela Costa from Brazil.
Taisha de Pena, Dominican Republic.
Basant Albana, Egypt.
Angel Mary
Vyas from India.
No, hang on. We need background. Come on down.
Loren Jetri, Albania. Nader Hanna from Egypt.
Armegan Hojati Sabet, Iran. Swira Jammu from India. Shravanti Kanta, India.
Sangeeta Karunakaran, India. Sayeda Kakab, India. Chandip Kaur, Canada.
Karandeep Kaur, India.
Excellent.
Paramdeep Kaur, India.
Shubh Sangeet Kaur from India.
Arjun Kinney, India.
Maurvi Pandya from India.
Ajay Parasia from India.
Ana Perez, Venezuela. Mugdha Raut from India.
Elvi Roci from Albania. Hi. Thank you.
Liani Rodriguez from Cuba.
Thank you.
Srijana, South Dakota, Nepal.
Pleasure. Congratulations.
Christina Sarkisova from Ukraine.
Shruti Salam from India. Krisha Shah, India.
Naya Shah, India.
Congratulations.
Sunita Jayati Sharma, India.
Congratulations. Thank you so much.
Taiwo Shoyombo from Nigeria.
Welcome. Congratulations.
Afreen Sayyada, India.
Hello. Congratulations.
Fadi Sliwa from Iraq.
Welcome.
Almost like your dog.
Thank you. I love my job. There you go. Get to do this too. Right? Congratulations.
Fatima Torres, Dominican Republic.
Welcome. Congratulations.
Diana Vera Nunes, Peru. Hilda Verdisha Garcia from Cuba.
Congratulations.
Thank you.
Yusuf Adel Yusuf, Egypt.
Last but not least, welcome. Congratulations.
Okay, congratulations and a round of applause for our new class. pledge. I wanted to introduce Dr. Glad, Associate Dean for Academic Policy, to lead it. Dr. Glad was not my student, but she was a colleague of mine at Columbia University last century. So,
Just seems so long. Is that COVID? In which case?
Good.
Now it's time for the pass class of 2025 to recite the professional pledge found in your program. In the presence of everyone here, your family, your friends, peers, faculty, and staff, you will publicly acknowledge the responsibilities of the profession and your willingness to assume the same. So I ask that the pass class of 2025 please rise. And follow after me as we recite the pledge. Please repeat each line after I've recited it. As I enter the dental medicine profession and begin my education, I vow to keep this pledge and these stipulations. I understand that I have chosen a profession that holds a special position of high ethical standards, trust, esteem, honesty, and integrity as the foundation of the doctor-patient relationship. Good, good. I recognize that as a professional, my primary responsibility is to my patients. And hence, I will properly prepare myself to deliver a lifetime of competent health care, always placing the needs of my patients and community first. Good. I pledge to render the highest standards of oral health care and to maintain a relationship of mutual respect, truth, honesty, and confidence with my patient, peers, and community. I will always protect my patients from harm. I pledge to interact with others in an environment of mutual respect, truth, and honesty during my dental training and beyond. All this I pledge with pride in my dental medicine heritage and my commitment to the profession and the public we serve. Good. Well, Dr. Heingrus, what do you think? I think you did great, You're first. Please be seated.
Okay. Thank you so much, John. Congratulations again to everyone. We will now, just to announce that we have a reception on the upstairs. I would like the students to leave first so we don't congest the doorways, and the guests after them. Thank you very much for attending, and we'll see you upstairs.